Well, for more on this, I'm being joined by the Plateau State Commissioner for Health, Dr. Cletus Shurkuk. Good to have you on the news at this time. So first off, briefly give us now an overview of the current Lassa fever outbreak in the state, including the number of confirmed cases and affected areas.
First of all, my name is Musa Ashams, Commissioner of Information and Communication. I'm not the Commissioner of Health, and we work for the same government, that is the government of Plateau State. We had the cases of Lassa in Kanam and Kwampan local government areas of Plateau State. In Kanam local government, we have Takwar community, where a man and his wife were affected. The man eventually died, and we had to track those persons that had contacts with him, about 120 of them with him and his wife. So his wife is receiving treatment at the ATBU Teaching Hospital in Bauchi as we speak. The Kwampan case, the Kwampan scenario happened, and the patient was taken to Shandam, where the patient gave up the ghost. So as we speak, the Plateau State Ministry of Health, the Plateau State government, is strengthening its surveillance system by training disease surveillance notification officers to look at the 17 local government areas that make up Plateau State. And we've also engaged private healthcare facilities so that we'll take this disease out of Plateau State. So far, we have lost 2 persons to Lassa fever, and all suspected cases have been tested, and they have come out negative.
All right. So now we also understand that Lassa fever is a hemorrhagic illness which is known to occur within this time of the year, especially in the northern region. Now, how prepared is the state's healthcare system to handle these kinds of outbreaks?
We've had a robust relationship with the NCDC. As we speak, we have training in conjunction with the World Health Organization and the Nigerian Center for Disease Control. And our facilities are ready because we've had this challenge in the past. We've had cholera, we've had Lassa fever. So we do not wait until our people are affected before we begin to look for ways out. So the synergy, the collaboration, the conjunctions that we've had with all these organizations has helped us. So like I said, our personnel are ready.
All right, he seems to have having a bit of a connectivity issues with the Commissioner for Information, giving his insights on the outbreak of Lassa fever in Plateau State, which has already claimed the lives of 2 persons. And already we understand that Lassa fever is a hemorrhagic illness caused by infected rats. And this, of course, is taking a toll mostly in regions in the north. Well, I understand he is back online now. Commissioner, can you actually give us a breakdown rather now on the immediate actions being taken by the ministry now to contain the spread of the virus since the outbreak was first identified?
Yes, we're on a sensitization drive. We've produced jingles in local dialects so that our people will understand what is happening, so that when they have the symptoms that have been itemized by the Commissioner of Health, which is headache, nose bleeding, and other issues, they should contact the closest or the nearest health facility. And the facility managers have been trained. They've been exposed to how to handle these matters. And we're also calling on our people that when you have issues like this, please try to avoid contact with others. Like I said, we've tracked 120 persons that had contact with the couple that were tested positive, which we lost the man, and all of them have been tested negative. And we hope that more people will not have contact with other persons. And as we speak, we only have 2 casualties, which is not bad, but we hope that our people will be hale and hearty so that we don't lose more people. So as a government, we're working hard to see that we do not have more suspected cases. And in the event that we have, our health centers, our health facilities have the capacity to take care of these issues, of these challenges.
All right, in as much as the government is taking a step towards addressing these issues, what are the long-term strategies do you think the government is adopting to ensure these outbreaks are effectively, the burden of disease rather is being reduced to the barest minimum?
Like I said, we are doing trainings and retraining. We're exposing our people to the ways to handle these issues. Like just yesterday, the Ministry of Health came out from a retreat. All the agencies under the Ministry of Health were in Miango Rest Home here in Jos to have a look at all of these issues, so that Plateau State will not feature when you're talking about diseases like this, Lassa, fever, cholera, and all those issues. So we have to prevent them. Like the Executive Order 003 was in the interest of our health too, because you find people building their houses by riverbanks, you have people building in community and choking their communities, so that when there's an outbreak, it can affect your neighbor and all of that. So we're decongesting the city. We're making 70 slums to become semi-urban areas. We're making sure that open defecation is defeated. The Plateau State Environmental Protection and Sanitation Agency, the Jos Metropolitan Development Board, is a synergy. It's a collaboration with all agencies of government that have a link to the health and to the health sector. So as a government, we will not fold our arms to see our people become diseased. We'll do whatever we can do within our powers, within our reach, within the Constitution of the Federal Republic of Nigeria, to secure our people, to protect our people, because it is a known fact that health is wealth. Right. So we are after the health of our people, we are after the wealth of our people and the well-being of Plateau citizens.
Right, and that's a fine place to leave it, Commissioner for Information Musa Achong. We appreciate your insights at 10 tonight.
Thank you for having me on the news at 10. God bless Plateau State.
Coming up on TVC News at 10, All Progressives Congress in Osun State welcomes members of the People's Democratic Party into its fold. Details